Hi, how's everybody doing? Good. It's so wonderful. You guys look so beautiful. There's so many people here. So, anyway, I love this cartoon. Do you see it behind me? That's. I have to apologize. I'm in a wheelchair. I'm not going to be standing up much today because I actually have a cast on my leg. I tore some ligaments in my ankle. So please forgive me. I won't be doing any cartwheels or anything for you today. No entertainment, no tap dancing. So let's get started. I got involved with Alzheimer's disease because of my great Aunt Mardell. She was a wonderful lady. My great uncle was mayor of Poplar Bluff, Missouri. I don't know if any of you know where that is. And she was like the first lady. She and I would have tea parties. And the reason I picked this picture is because we would dress up in her hats and her furs and her high heels and have little tea parties. Well, after she developed Alzheimer's disease, I didn't get to have those parties with her anymore because she didn't remember who I was. So I kind of vowed as I grew older that I'd become a nurse, and then subsequently went on to get my degree as a geriatric nurse practitioner so I could help those who have Alzheimer's disease and dementia-related disorders. So that's a little bit of my background, but she is near and dear to me. She has passed on, so by the way. All right, so what is Alzheimer's disease? I want you all to follow along in your packets. I've given you quite a bit of information today, and I'll try to go through as much of it as I can. I do have some information up here with me that I just don't have time to share with you today about alternative therapies to medications. So if you do have questions about natural preparations, I'd be happy to talk to any of you about that or steer you in the direction of where you can find that. So Dr. Alzheimer's first described this disease in 1906, started with forgetting recent events, family noticing, forgetting familiar tasks. It's the most common question I get is how does it advance from person to person? I can't tell you exactly. It's going to be 5 years, it may be 10 years, it may be 20 years. We'll talk about that a little bit more. I want to click through this slide and go on to what is dementia, because we're going to focus today primarily on Alzheimer's disease, but I wanted to tip you off that there are many, many types of dementia. Dementia is an umbrella term for all of these that I've listed here. Vascular dementia is one that occurs in folks that have had strokes. So dementia with Lewy bodies, frontotemporal lobe dementia or Pick's disease can be caused by head injuries or trauma. Wernicke-Korsakoff's dementia is caused by, it's a lack of thiamine or B1, but it's usually caused by alcohol intoxication or alcohol abuse over time. And then people with Parkinson's disease can also get dementia as well. So I'm going to go on to a wonderful video that we have here. I think it can explain this a little bit better than I can.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
I'd encourage you to go out to that website. It's actually, I've given it to you at the end of your PowerPoint papers. And they have multiple presentations that are just fantastic about all different facets of Alzheimer's disease. Okay, so let's go on. I'm going to talk really quickly about other different types of dementia. As previously mentioned, one of those is post-stroke or vascular dementia. You don't see a lot of memory loss initially in this type of dementia, but you do see impairment in judgment. That would probably be the feature. I did give you some symptoms there, and also, if you're interested, the brain changes that might be seen on imaging. I'm going to go ahead and move forward so we can get to Alzheimer's disease. Dementia with Lewy bodies. Again, symptoms can show some Parkinsonian-like features, slow gait, slow speech, rigidity. But the big hallmark of this is the hallucinations. And so if you have a family member that is having visual or auditory hallucinations and full-formed hallucinations of people that you know are not there, but not so much the memory loss, you may want to come see a provider regarding Lewy body dementia. Again, there's some information about brain changes that you might see. Frontotemporal lobe dementia, just real quickly, again, that's seen in head injuries, usually from long ago. They can be recent. And then on to Wernicke-Korsakoff's dementia. And again, that is seen mostly in people who are long-term alcoholics and or have had done quite a few possibly illegal substances. And that's because of the lack of thiamine or B1. Here I've given you some facts and figures, and this is from 2012. The 2013 figures aren't out yet. 5.4 million Americans are living with Alzheimer's disease. It's quite a bit. And 1 in 8 older Americans has Alzheimer's disease. And there's actually some information that I've given you later in the PowerPoint that Alzheimer's disease, you're at risk over the age of 65. There are some cases of folks as young as in their 30s that they found developing Alzheimer's, but usually starts after the age of 65. And that percentage is about 80%. Every 5 years after that, it goes up until it's about, I'm sorry, not 80%. Let me go backwards. At the age of 85, you have a 50% chance of developing Alzheimer's. That's what I'm trying to say. Alzheimer's is very expensive, okay? So you can see here, estimated 200 billion was the cost for treating people with Alzheimer's disease. So we are really needing to find some kind of cure for this. Right now we don't have anything. And I've gone on to elaborate a little bit more about the costs because of lack of time. I'm gonna let you read that on your own. Now, this is what I really want you guys to pay attention to, and I get a lot of questions about this. Know the signs. One of the big things that when I'm doing a cognitive evaluation with patients is they say, I forgot what I was going in the room to get, and then I had to go back out and go back in, and that is not dementia. Okay, so this is what this is long and tedious, and that's why I skipped over some other things to put this in here, but I want you to know, what's a typical age-related change? Memory loss that disrupts daily life is a common sign of Alzheimer's, but what's a common one? What's something that we all might do? Forgetting names or appointments, but remembering them later. So that's not Alzheimer's, but something that really disrupts your daily life, you have to ask somebody over and over and over, when's my appointment? What's my address? What's my phone number? That is a concern. Next, challenges in planning or solving problems. If you make an error in doing your checkbook once or twice, you don't have Alzheimer's disease. But if you've forgotten how to do your checkbook, that's something that you usually used to do and plan, doing your budget, maybe planning a vacation, knowing how to get to the grocery store, the route you used to take. That might be Alzheimer's disease. Number 3, completing familiar tasks at home that you used to do. So if you get a new, what is it now, a Blu-ray DVD player, and you don't know how to, set it, you don't have Alzheimer's, okay? So, I don't know. My fiance is sitting right over here, and he has to do all the electronics, okay? Because I don't know how to do any of them. That is not Alzheimer's disease. But let's say you walk into your bathroom, and you look at your toothbrush, and you forget how to use it. Those are the kind of things I'm talking about. Sign number 4, confusion with time or place. Now, we all get busy, and we probably all forget to look at the calendar every once in a while, and we may misplace our dates. That is not Alzheimer's disease. But if you really can't tell me when I come and ask you, what's the time or what's the season? Are you in, what hospital are you in? What city or county are you in? That might be the, Alzheimer's disease developing. Trouble understanding visual images and spatial relationships. So that's on one of our cognitive tests as well. And again, you have to make sure that's why we do vision testing and hearing testing, because we want to make sure there's no other deficits or physical changes that are causing you to not be able to see or hear, Okay, and here's what I'm having now, problems with speaking and writing. So, finding the right word. We all trip on our words every once in a while. That is not dementia. However, if you go and make up words, here I think I gave the example is if you say, instead of watch, you point and say hand clock because you can't recall the word or you're having word finding difficulties, then you probably should see somebody and see if there's something going on. All right, number 7, misplacing things. I don't know where my car keys are right now, but that doesn't mean I have Alzheimer's. So, but from time to time, it's okay for you to misplace something, but the key there is your ability to go back and retrace those steps and find that object. So, people with Alzheimer's disease might lose the ability to keep track of items. Number 8, poor judgment. We all make bad decisions once in a while, but if you are consistently making bad decisions, you're spending too much money, being inappropriate in some way, then that too can be a part of dementia. Okay, and number 9, withdrawing from social activities or work, tasks that you used to find enjoyment in. One of the the components that we see a lot in conjunction with dementia or Alzheimer's disease is depression and anxiety. And those symptoms can be withdrawal from things that you used to enjoy doing. So, but sometimes just being tired and needing a break from family, work, or social situations, that's normal. Everybody needs a break occasionally. Can you all hear me okay? Okay. All right, and then lastly, changes in mood and personality. And like we were just talking about, some types of dementia are more prevalent in showing the hallucinations, the aggression, suspicion, and before the memory loss. But in Alzheimer's disease, people, show the confusion, suspicion, paranoia, and here's depression again, or be anxious or fearful. So, all right, so let's move on. 7 stages of Alzheimer's disease. Number 1 is no impairment. I mean, we don't ever get to anyone at stage 1. Stage 2, very, very mild cognitive impairment. We probably, I would say even the family and friends might not know yet, and probably as a professional, I might not be able to detect it either. Might be a little bit of forgetting names, places, and sharing that with the family, but a lot of times people at stage 2 compensate by making lists and bringing a family member with them to the appointment and deferring to them to give answers. So we may not pick up on it right away. Stage 3, this is where usually we catch it when we're at the clinic, because we start to do some cognitive testing, do a health history and some other items. And this is the families noticing, friends are noticing, maybe coworkers noticing, people being forgetful and not being able to do their work, participate in activities, or losing objects. Stage 4 is moderate. And again, we can really pick this up on cognitive testing. Sometimes we don't get to people before this stage, but they're now having to use their family members to help them do finances, maybe cook, take care of the household duties, or they may be having to go into an assisted living facility because they can't manage their own independent activities of daily living, as we call them. Stage 5, this is moderately severe. This is when the gaps in memory are really noticeable. There may be still some long-term memory present, and they can speak to you of that, but here the short-term memory is having great difficulty. Stage 6 is a severe cognitive decline. This is when we really need people to have quite a bit of help, almost moderate to total assist with activities of daily living, toileting, bathing, dressing, and so on. And of course, stage 7 is very severe cognitive decline, and that's the latter stages of Alzheimer's disease. They really aren't able to respond to their environment. So, our total care. Do we have any questions yet? We'll have some, go right ahead. Does Alzheimer's disease always affect the short-term memory before the long-term memory? And the answer is yes. Most of the people that have Alzheimer's disease retain their long-term memory. Some of my patients, one of the things that I used to do in the Alzheimer's unit is I would sing hymns to them. And they may not respond to me at all during the day, but as soon as I start to do a hymn that they grew up with, they could start singing with me. So it was the long-term retention of that song. But if I taught them a song today, they wouldn't have remembered it. They wouldn't have been able to do that. So, yeah. Did you want me to wait, Laura, till the end to do questions?
No, Wendy, I am just going to let you run with it.
I'm going to run with it. Not very far in my wheelchair, though. Okay. All right. So, steps to diagnosis. I've been talking about these all along. We're going to do a complete health history and a head-to-toe physical as well as cognitive testing. Quite a bit of laboratory and diagnostics can be done as well. Now, ultimately, we can't really truly diagnose Alzheimer's until death. And then we can do an autopsy, and we will see the plaques and tangles that are indicative of the disease process. But let me, what? I heard somebody laughing. No? Okay. I thought I had gone to my cartoon already. I have days like that sometimes. Do you? But let me reassure you though, about 90% of clinicians that are trained in Alzheimer's disease and dementia-related disorders can diagnose you. So we can start treating you. So rest assured, we do have clinicians out there that can do this and get you started on medications and treatments that can retard the progression of the disease process. Can't stop it, but can slow it. So, all right. So history, physical, and neurological exam, exactly what it sounds like. We're going to take your vital signs. I'm going to look at you from head to toe, do a neurological exam. And so what I'm looking for here is I'm sorry. Question. You know, that is a really good question. I don't know the answer to that. I'll have to look that research up. He asked are we born, the plaques and tangles that form in our brain as Alzheimer's disease progresses, are we born with them? I don't think we're born with the plaques and tangles. I think we might be born with a genetic position to develop them later in life.
Well, my mother had Alzheimer's and she finally succumbed to it. And I'm just wondering whether or not it's genetics. I mean, if it's a family, some family member has had it, does that mean that somebody in the family later on, some sibling is going to get it?
They could. He asked, is it genetic? Basically is what he's asking. And yes, there is a genetic component. If you have a close family member, mother, father, sibling, even a daughter or a son, you are predisposed to having Alzheimer's disease. There is a chance. And there is genetic testing going on. And I have included some of that information in your packet. So, thank you. Okay, so let's move on here. Mental status testing. We do something called the mini mental status exam. How many of you have done this? Anybody? Okay, you haven't had that grueling questions and spell world backwards? Serial sevens, do those? Okay. And then diagnostics, we're going to do blood work and imaging and lab work, and we'll do a depression scale as well. So, and here's what I said to you before. 90% of us that have experience with geriatrics or folks over 65 are skilled at doing this type of testing and recognizing cognitive impairment. So rest assured, you do have folks out there that if you're concerned about a family member or yourself, we can assist you. Do you see this? Mr. Potato Head? Okay. All right, we're going to take a quiz. You guys ready? You don't have the answers on your sheet, do you? Okay, good. All right, just anybody call out. Memory loss is a natural part of aging. False. False. It is not. No. Alzheimer's disease is not fatal. That is correct. Only older people can get Alzheimer's. False. That's right. There have been younger people that have gotten it. It's very rare, but there are cases. Drinking out of aluminum cans or cooking in aluminum pots can lead to Alzheimer's. False. That's right. Aspartame or certain sweeteners can cause memory loss. It's false. Flu shots increase the risk of Alzheimer's. False. Yep. Silver dental fillings increase the risk of Alzheimer's. False. Yeah. And lastly, there are treatments available to stop the progression of Alzheimer's disease. And we're working on those. It won't stop the progression, but it may slow it. So technically that is false. But we can slow it with medications like Aricept, and I'm going to go into those in just a moment. So, risk factors. Know your risk factors. I mentioned these earlier. Greatest known risk factor for Alzheimer's disease is advancing age. So if you're over 65, you are at risk. And then after the age of 85, the risk reaches nearly 50%. So, and then family history. This is what I was talking about with this gentleman earlier. You know, if you have a parent, brother, sister, or a child with Alzheimer's, you are more likely to get it than someone who doesn't have a familial history. And then again, genetics. We're looking at risk genes and deterministic genes to see if we can pinpoint. All right, and again, more information can be found at alz.org. Yes?
Does Medicare cover those costs?
The cost for?
Exam, I'm sorry.
Oh, yes, they do cover cost of the exam. She asked, does Medicare cover costs of an exam? And actually, you know, when you go in to establish with a provider or your doctor and you get your physical, they're going to be doing some cognitive testing initially, probably, to establish a baseline. So if you come back later and say, you know, I'm forgetting things, can you test my memory again? They can have something to compare it to. But most of this testing, if not all, is covered. Now, the genetic testing, I'm not sure yet. So I'd have to check into that. But that's a good question. Okay. U.S. Food and Drug Administration, or the FDA, has approved 2 types of medications to treat Alzheimer's disease. Cholinesterase inhibitors, which is Aricept, Exelon, Cognex, and Razidine. And then the next one is memantine or Namenda. Everybody say that. No? All right. So, now, Aricept is the one that I like to use most often. It's approved to treat all types of dementia. So that is a really good one. I saw a question. The question is, do I use the same medication to treat dementia as I do to treat Alzheimer's? I do in some cases. It depends. If I have a patient who has Lewy body dementia and they're having quite a few hallucinations, I might use a drug that's for schizophrenia and to treat those hallucinations, like Seroquel or Risperdal. So there are different medications for behaviors, and actually that is further in our PowerPoint too, and I've given you some information for that. So, Exelon is a really good one too. It's used to treat moderate Alzheimer's, and then Razidine is to treat mild to moderate Alzheimer's. But my go-to medication is initially Aricept, and I start patients off on 5 milligrams, and then after 4 to 6 weeks we will reevaluate to see if it's working, and increase them to a maintenance dose of 10 milligrams a day. How does that work? That's a complicated question, but I do have information about that up here if you want to come see me after. Okay. All right. And then memantine is used later for moderate to severe Alzheimer's disease. I don't generally start with this one. I may use it in conjunction with Aricept later. So, and actually, you know what? If you look down at the bottom of the PowerPoint, ma'am, it gives you the description of the action of the medication. Okay. So what can we do? What are non-pharmacological treatments that we can do for our family members or for ourselves? Getting information is key, and that's why we're doing, doing this program today. We want to let you know what you can do and who you can go to if you need help. Your local Alzheimer's Association is fabulous, and we actually have meetings that you can attend locally, and they can give you all kinds of information. Who has a computer here? Is everybody on laptops and computers now? Quite a few of you. You can get online on the Alzheimer's Association, and you can get tons of information. So, and all kinds of videos, and it's really a good resource. So, another thing you can do is you can modify the environment. Someone who has Alzheimer's disease is going to be very hypersensitive to lights and sounds, and you know, that can greatly affect behaviors. It greatly affected me today. Let me tell you, this afternoon I went and had lunch with my fiance, and there was a baby screaming and yelling at the table next door to me. And I was, anyway. So if it can affect me like that, imagine what it would do to somebody who has cognitive impairment and is confused, and it would just be very, very distracting and upsetting. Can I help you?
Yes, when talking about health issues related to the heart disease, there's plaque, there can be plaque in your veins and stuff like that. Is that any different from the plaque that we're talking about in the brain?
It is different, yeah. Yeah, that plaque is more related to, her question was, are the plaques that we see in like coronary artery disease or when folks have strokes or heart disease, is that different from the plaque in the brains? And it is. It's actually a different protein and versus lipids or high cholesterol or high fat in the diet. So, okay, so for folks who need help, establishing routines is really key. I used to run an Alzheimer's unit, and we had routines from 6:30 in the morning till 6:30 in the evening, and there were activities planned every 15 to 30 minutes. And that wasn't like an activity like singing or dancing, but that was like, you know, dressing, eating, brushing your hair, brushing your teeth, you know, doing things like that. It was structured. So a structured environment is very good for the person in your family that might be having problems in planning and doing activities of daily living. So, all right. Oh, here's something for the new age grandma. Playing on the Xbox, knitting on the Xbox. I loved that one. Okay, here we're going to talk about some behavioral issues. If you have a family member that has progressive Alzheimer's disease and they're developing behavior problems like suspiciousness, aggression, agitation, depression, and so on, hallucinations, insomnia, one of the big things that Alzheimer's disease, patients do is wander. And they wander not because they're trying to make our lives difficult, but because they might be in pain and they don't know how to express it anymore. You know, they might be irritated about something, or they may be thirsty or hungry. So the best thing that we can do for our family members is do the ABCs, and it's down here at the bottom. You're looking for what triggered this behavior. Why did they get angry? What was the behavior? And then what was the consequence? Or what did you do to assist that behavior? So, because again, they need direction, they need focusing, and they need planning, because they can no longer do that. Yes? Oops, I'm sorry. Oh, that's a good one. Is there a difference between hallucinations and sundowning? Yes. Hallucinations are obviously seeing something, hearing something, smelling something, feeling something that's not there. Sundowning now, and I can give you a really good example. I had a little guy, all his life he had been a farmer, and he owned a dairy. And every morning he'd get up and he'd milk the cows, and then every evening he'd take care of the milk and put it away, or whatever you do with milk at a dairy farm. I'm not quite sure. And but he had his routine schedule of what he did. And he was at the Alzheimer's unit. He got so agitated at like 4 o'clock in the afternoon. He was beside himself, and he had to go take care of the milk. He had to go take care of the cows. And so what we did is we got a container, a milk container. We sealed it and put milk on the outside of it. And we told him every day at that time that we had taken care of it, that he didn't have to worry about it anymore. Now, this same man had a strict, you know, he would eat at home, and he felt he didn't have any money. He was a poor farmer, and he wouldn't go into the dining room at this Alzheimer's unit because he said he didn't have any money. Well, we got creative, you know. We put a sign up on the dining room that said, "Farmers eat free." And he ate, and he came in. So sundowning is very different from hallucinations. It's a set routine that they're, again, long-term memory. They're hearkening back to those days where they had a set routine. And they know that they have to do something, and they're agitated by it. And they can't, they're out of focus with person, place, and time. They're not where they should be. And so we have to redirect them. But that's an excellent question. Yeah, you're welcome. Okay. Oh, I'm sorry, we had a question over here. I answered it. Okay, good. You're welcome. This is what I was mentioning before. We have pharmacological treatments, antidepressants for depression, anxiolytics for anxiety or disruptive behaviors. And that's not disruptive to us, that's their lives being disrupted. And then antipsychotic medications for hallucinations and delusions and aggressiveness and agitation. On this list, I like to use Celexa and Paxil as antidepressants, Ativan as an anxiety medication, and I use Seroquel and Risperdal quite a bit with my patients who have some behavioral, some hallucinations and some aggression. AARP. I know, I'm silly. Okay. Again, let's talk about the environment. Now, this is really key. If you have a family member that you feel is developing some type of memory loss or dementia and they can't plan and they're not as aware of their environment as they used to be, you can do an environmental assessment in their home and you can make sure there's no scatter rugs on the floor, there's no cords laying around to help not only prevent safety but falls. You know, security is a concern. So, all right, let me see if I can do this video again.
Alzheimer's, a message for newly diagnosed patients and their families. If someone in your family has recently been diagnosed with possible Alzheimer's disease, you're probably feeling overwhelmed right now with worry and responsibility. Please realize that while the burden is a heavy one, there are excellent resources available to help you and your family navigate these choppy waters. First and foremost, of course, is your doctor, who should help you understand what your diagnosis is, what it means, how to treat the symptoms right now, and how to reevaluate the diagnosis as time marches on. Another important step is to seek out legal and financial experts who can help you with estate planning, power of attorney, and long-term care insurance. These arrangements are critical. It's impossible to overstate the importance of getting one's affairs in order before the illness progresses. And finally, there's a wide network of social services available to help your family with financial, physical, and emotional support. With the help of others, you can learn more about this disease, find the right doctor, join a support group, and get the caregiving help that every Alzheimer's family needs. Please let your community help you face this challenge. For specifics on how to find the right services in your area, go to www.aboutalz.org.
Those are just wonderful little videos, and they have all kinds of videos like that about a plethora of information. We're almost done. Communication. Oops, there's a hand. Yes.
Video you just showed, are there any resources available other than sending your loved one to a, for lack of another word, old folks home?
Are there any other resources available other than just sending your family member or loved one to an old folks home? Yes, there are.
They could stay with you in your own home.
Oh yeah. It is, and we're getting ready to talk about some caregiver issues, but you know, it would be wonderful if everybody could age in place. That means staying in your home, being around your family member. That's just the best care ever. Unfortunately, if someone progresses too far, you may need that extra help. It's awfully hard for, say, a husband and a wife, or a wife who is the same age, to take care of an ailing husband with Alzheimer's disease. And so you have to go into a facility. But until you reach that point, you can use home health services. You can use caregivers that come into the home and help you out with daily tasks. There's all kinds of things that we can do. And what we would do is hook you up with our social services coordinators, and they can help you find those resources in the community. So you don't have to just, once you get the diagnosis or the family member gets the diagnosis of Alzheimer's, have them go directly into a care center or an Alzheimer's unit. There are many roads that you can take. And one of those is being at home or aging in place with the family with enough support. Yes?
Is Alzheimer's more likely for men or women or both?
Both. It doesn't discriminate. So it's a good question. Is Alzheimer's found more in women than men, or vice versa? And no, it doesn't really discriminate. Anybody else? Oh, I see hands. Oh, where do I start? The way back in the back there was first. Can you make an appointment to see me? Absolutely. Absolutely. I'd be happy to see any of you. So, all right, I'm going to go on and then we're going to talk about supplements and different natural preparations and vitamins that we can use. But I'd like to cover a few more things. All right, so I've given you some tips on enhancing communications with people who may have dementia. We'll skip over that. Caregiver stress. This is really, really important. If you are a family member, if you are a spouse, if you are a child of someone who has Alzheimer's disease, it can be very, very stressful. You just need to, I put this in here so you remember that not only are you going to be aware of taking care of their needs, but you need to make sure that you're taken care of as well, because you can't help your family member unless you are supporting yourself. So, and here's some warning signs of caregiver stress. And then also ways to reduce caregiver stress. And we do have resources also through the Alzheimer's Association that will help you, and we can help you with a plan to reduce your caregiver stress, whether that be respite, to where you can take a few days away from the situation to recoup and then come back to it. Clinical studies and research. I want to point this out. If you go to the Alzheimer's Association website, if you or a family member, friend has developing Alzheimer's disease, there are clinical trials out there that you can register in. So feel free to go to that website and look, because you may be able to be enrolled. And they're testing all the time. So I wanted to put that out there. This is my prescription for you today. 1 tablet by mouth every 6 hours for humor. Laughter is the best medicine. So, my references, alzheimers.org is the Alzheimer's Association website, and then the aboutalz.org is the website that had those wonderful videos. And I want to now address your questions about alternative medications. One of the things, and I know I'm going to mess this up, ginkgo biloba, ginkgo, I'm going to say ginkgo, okay? That is a supplement, a natural supplement that has been recommended. Also CQ10, let's see here. Coconut oil, omega-3 with fatty acids. I made myself a list from super supplements. And caprylic acid with coconut oil. You know what I recommend that you do? I recommend that you go see the people over at Super Supplements. I think there is one off of Clearwater. I can't remember the cross street. Tell them you are interested in, I'm sorry? Oh, Clearwater Medicine, gotcha. And they are excellent in pointing out where the CQ10 is. Any of these that can help with memory, focus, and cognitive function. And you can tell them Wendy sent you. Okay? Yes, Super Supplements. Or you can go to GNC and General Nutrition Centers. Any of those places that would have herbal preparations or supplements, vitamins. Does that help, sir?
Yes, thank you very much.
You're welcome. Yes, I have a question. You know what? I'll tell you what I would recommend that you do. Her question was, do these people in some of these health food stores and have the background to recommend a supplement for me? I would go to, again, alz.org, and there is a complete list of supplements on that website with all of the information about what these things can and cannot do and what the concerns are about using them. Because these aren't FDA trials. These are just natural alternative therapies is what they're called. But you can go to this website and you can take this with you, and you'll have information from the Alzheimer's Association to defer back to if you have a concern about the person that's helping you. So, any other questions? Yes. You know, that is beyond me because I'm not a specialist in insurance, but again, the social services or any of the there are state and local agencies that can help you determine where to access monies if it's available, and they can help you do that. But I'm not sure. I'm not good with the insurance side of it and everything. That's just not my forte. Sorry about that. He was asking about how to finance some of the care. So, yes. You know, I haven't found that. So she asked, is Aricept no longer good after like 3 years or so? I haven't experienced like a medication that you might take for pain that you become accustomed to or you have a tolerance for. I haven't found that with Aricept yet. So, good question though. So, anybody? Yes, sir.
Does anybody like, say, the Mayo Clinic or any medical big facility, are they getting any closer to solving this problem of curing Alzheimer's? Is there any hope out there?
That is a good question. He said, is there any hope out there? And there is. Actually, I brought information about that. And again, I would really like for you guys, especially you, sir, go on the website, alz.org, and it's going to show you all of the clinical trials that are happening right now, and it will give you hope. Okay? So, and you can be a part of that. But there are new grants that are going to be funding research all over the place. So instead of giving you this many pages of list about what is new and upcoming, I recommend that you go to alz.org and look into it. And if you do have a family member that you feel would benefit from a trial or be a part of a trial for future hope, you know, and to help solve this, you know, please enroll them. Yes. Come on up. No? She said, yeah, I'm going to have her say this out loud for you guys. There's actually a trial in Canada that's been relatively successful, and however, it's not available yet here in the United States. And I recognize you. Hi.
Hi, I really don't know any more than she just said. No, it was on TV. I don't know if it was Nova or some program. It was excellent. And this was an early Alzheimer's patient. I think he was 40s or 50s only. And they implanted electrodes in the brain like they do for the cardiac pacemaker. And of course they don't have, it isn't hanging down the face or anything. I don't know exactly how they did it, but they were very successful. And the man spoke on the program and said he had regained a lot of memory. So I think there is hope.
Good.
Thanks.
Thank you. You know, yes.
I'm wondering, you mentioned the supplements. What is their effectiveness? Are they better, the same, or not as good as the normal, like Aricept and Namenda?
Well, again, you know, there haven't been any FDA trials on those supplements, so I really don't have that answer for you. I'm sorry, sir. On Aricept, Namenda, and Exelon, all of the medications that have been approved, they've been in trials for years. The supplements that they're recommending now, like the coconut oil and things, that's relatively new. So we really don't have a lot of accumulated data, and there's no one officially doing those trials.
Do they also list the side effects of the supplements?
Yes, the side effects are on the information on alz.org for each one of those. And there are quite a...
On the package that you buy.
No.
So there's tremendous risk involved.
There is always risk in using alternative therapies, even vitamins. So I want to thank you guys. God bless you all. It has been wonderful to be here today. If you have any questions, feel free to come up and ask me. And again, you have a wonderful afternoon.